Yo, what's going on, guys? Chris Bonner here, Overtime Athletes, making another video about injuries. I'm trying to go through the main injuries that I experienced with a lot of my athletes, a lot of you guys, the consensus out there, and I kind of want to basically discuss my approach, if it can support you. I'm not saying that, let me say that some of these things are out of my scope. When I deal with somebody with an injury, I approach it from the best way I know how. Obviously, I went pre-med in college. That was a long time ago. I tried to dabble in, obviously, when you're going that route, a lot of physical therapists come through that too. So a lot of that background that I had from my education is from that. But as you start working with athletes and you start developing your own protocols with certain injuries, you have your own styles and the ways that you approach it. Now, a lot of these are taken from other physical therapists or people I might mention, or I might that might deal with these kind of injuries. But if it's out of my scope, I'm not afraid to admit that. I have no ego in it. My whole purpose is to get that athlete better. So if you're somebody who's experiencing one of these, little nagging injuries or prone to it, hopefully one of these things or something that I say, a tip that I give you, can support you in bettering yourself. And today what I'll be talking about is lower back injuries, and basically, or essentially, my protocol for supporting somebody. Now, there's ways that doctors can offer surgeries and stuff like that, and there's other ways where I've had athletes who have been suggested surgery, and I've completely had them or doctors say completely stay off of it, and I give them my protocol and they've helped, and vice versa. Not saying that I've re-injured somebody, but saying that this might be able to support you. So when it comes to lower back injury, I've dealt with a slew of people. I've dealt with guys who have had herniations, athletes who have herniations from, could be from like a repetitive pattern, or, could be from lifting weights, whether that be anterior or posterior, or, to their lateral. Or as far as dealing with, if you guys have ever read the King book, I talk about Danny Gutierrez, who's a wrestler, high-level wrestler that I worked with. He's now an MMA fighter, who actually had a fracture to his spine, which is the most severe case that you could take with an athlete. So my protocol, where I approach it, is basically a 3-phase protocol, and it's kind of dependent on each athlete. I'll move them through those 3 phases. Each one isn't like a set time period, because each athlete's injury is independent to themselves, right? So I can't say, hey, on phase 1 it takes 1 month, on phase 2 it takes 1 month. Each one is basically having your hand fully on that athlete and what they're doing, and on their program that they're performing. So to kind of go through what I've done in the past with my guys is basically these 3 phases, and I'll discuss each one. So phase 1 is mobilize. First, before phase 1, you need to determine what the injury is. If you have a lower back injury, it happened during deadlifting, it happened during a trauma, whatever that situation may be, you should probably start trying to identify whether it's a herniation, a bulge, whether it's anterior, posterior, like I said. In Danny's case, it was extreme. It was a fractured vertebrae. So it's very important for you to determine that. If it's an acute injury where it's something that's not as painful, it's stiffened up on you the day after, you had it during, you felt it during a lift, you experienced some kind of stiffness the day before, it might be something more minor, and this will be for you. So the first phase you want to do is you want to mobilize. Really what I'm saying is you want to be able to stretch certain muscles so that it will take you out of the pain. So if you wake up that next morning and you're stiff, you need to find ways that you can mobilize so that you could take yourself out of the pain or stiffness you're experiencing. What I typically do, and what I'll commonly see, is a couple stretches to do with the hip, the pigeon stretch, the pigeon pose, 90-90, certain things to really loosen up the hip, kind of really rolling out your piriformis, whether that be on a foam roller or a lacrosse ball. So there's certain things I'm looking for to really mobilize that athlete to get them out of the pain. And by doing this, we need to really focus on those tight muscles. And a lot of the times, a big percentage of the time, the tight muscles is what put them into that injury, right? So what I'm trying to do in this first phase is really kind of relax those overly tight muscles that are pulling you into that position that allowed you to, that provoked you to injure that back. The second phase that I'll move into, after that muscle's loose and we've actually lengthened that muscle, or we've created less tension there, and we've been able to mobilize it, is stability. So from stability, what I want to be able to do is to re-strengthen the intrinsic muscles that line your spine, or that line your core, or basically this whole area of your midline, to strengthen it, so that when you do go do another deadlift, or you do go do something else, you're coming from a much stronger standpoint. And that looks in the way of, just like I said, I'm doing a lot of planks, or I'm doing a lot of static kind of holds, so that you can go ahead and continue to stabilize and strengthen your midline, or that area of the lower back. And then phase 3 is basically integrate and activate. This is where I basically take that stability, that muscle, the stability that we created in phase 2, and then start integrating it into more movements, or more strength movements. So what I'll do is, if I'm gonna do some form of a push or pull or squat, I'm finding ways that I can integrate the midline to be able to use the stability that's created now more in a dynamic fashion, so that you can actually test out that. And activate is essentially basically activating the muscles that might be dormant. If the hip flexors in our society, we sit a lot, so the hip flexors are tight, it makes the glutes dormant. So I might do exercises that are going to strengthen those particular muscles. Depending on what kind of posture you have, you might have weak lower abdominals. So I might do more activation integration with those types of muscles, activating those types of muscles. So that's really what phase 3 is all about. So there's my 3-phase kind of protocol. Stretch it out, get the pain relief in phase 1. Phase 2, let's start to strengthen that entire midline. Phase 3, let's put it to the test by creating more movement and integrating you into different movement where you're actually using that midline with paired or coupled, force coupled with something else. So I hope that helps. That's kind of my lower back injury protocol. I'll catch you guys next time. Hey, thanks so much for watching the video. If you're interested in becoming a better athlete, go ahead and click this box right over here. Today, we'll get you signed up for a free athletic course that's going to teach you how to become a better athlete, whether it be speed, explosiveness, strength, or just pure aesthetics. Go ahead and click that. I'm going to send it to you and get you started immediately.